Advisory Committee on COVID-19, who are also going to share useful insights in terms of where the pandemic is in Gauteng, including the team from the Department of Health, Mrs. Mope, who is going to share with us the rollout plan. The first thing I would like to say is that principally today we are focusing on two areas of our COVID response. The first area is education. The public schools are reopening next week, so MEC Lesufi is going to give a briefing about our readiness for that. That includes the issue of the matriculants. When are we releasing the results, the grade 12 results? So MEC Lesufi will give a briefing on that. And then after education, we will get a number of presentations from the Advisory Committee of Scientists and the Department of Health on where we are as a province. It is important, as part of my opening remarks, to say that defeating COVID-19 is the number one priority of the Gauteng Provincial Government. Making sure that in 2021, as we wage this battle against the pandemic, against the virus, making sure that we reopen the economy and launch on a path of economic reconstruction and recovery is our number two priority. So we've got to bring COVID under control to be able to attend to our number one priority. Bringing COVID under control includes doing all the things we have done that have brought us to where we are now. The fact that the second wave, which by all projections was going to be much bigger in infections, in fatalities, much bigger than the first wave in Gauteng province. The fact that all numbers and all evidence indicate that as a province we were able to contain the second wave very well does not mean that we are out of the woods. And I want to commend the people of our province, especially during January and February. People were really, really able to rally around the call of masking, social distancing, sanitizing, and avoiding going into crowded places. People were able to do that. So COVID-19 will continue to be the principal focus, but the game changer is the vaccination program. So when we get the presentation from health, it will be clear that we must continue to do what we have been doing. What is called non-pharmaceutical interventions are still necessary because the vaccination program will take much longer. We can't just abandon all those measures. And the reason the vaccination program is going to take longer is the story we now know. We were ready on the 10th, Wednesday, to launch our vaccination program. We were ready. The team from health is going to share with you the infrastructure we have put in place, the people we had trained, the institutions and the facilities we had identified. And I must say that the people of our province are very disappointed that we did not launch the vaccination program. That disappointment is understandable. I mean, when I watched the news on Sunday, the news from the researchers that AstraZeneca is not as effective as would have been initially anticipated against a certain category of patients or people who have COVID-19. I was disappointed, very disappointed. But I felt this week huge disappointment from healthcare workers who were ready, who were looking forward to this. But there were also a lot of community people who said they have worked so hard to persuade people to vaccinate. Some of these are religious leaders who have said, we have gone all out there to convince people that vaccines work and please vaccinate. So, yes. So we are disappointed that we couldn't start, but we understand that we are driven by science. And when science says this cannot work as it was expected, we pause. So we are not disrupting our plans. Yes, we have to adapt our plans. We have to adapt all the rollout plan, but the vaccination campaign, today on behalf of the Gauteng Provincial Coronavirus Command Council, I still want to say to the people there, we must all vaccinate. When the time for everybody to get the vaccine comes, and you will hear later that it's not just the one vaccine now. We're talking about vaccines. When that time comes, our message is still that get ready. And all the stories about vaccines don't work. Let's get over those stories. We will definitely make sure that our healthcare workers, who are our frontline workers, that presentation is going to give us an indication. This process is led by national government, but we are hoping that we will get the vaccine that's going to be rolled out with which is J&J. We will get that. We are more than ready. I want to repeat, we are more than ready. Health workers are looking forward to it, and they feel disappointed, but we say to them, don't be disappointed. It is just a setback. We have suffered a setback for a week. We must return to vaccinate. We're saying to communities out there, members of our communities, you listened to the president yesterday about what vaccines we are going to get. But even as we prepare for the rollout of those vaccines, we must continue to apply the current health measures. Let's continue to wear our masks. Let's continue to sanitize and wash our hands. And let's continue to maintain social distance in the environments where it is possible to do so. So we are reopening schools. The reopening of schools is often a moment of great anxiety for parents, for learners. The good thing is that we are reopening schools when the pandemic is under control. The evidence, the numbers show that the pandemic, the second wave is under control. But even with the schools, we must still say, MEC Lesufi, the schools, we must still implement these measures at our schools to make sure that the schools don't become the place for the outbreak of this virus, where learners will bring the virus back at home. So you will speak to that. I want to emphasize that defeating coronavirus is one important thing so that we can open other sectors of society, schools, make sure that our children, including ECD centers, are operating properly. But the big prize is getting the Gauteng economy on track. We will not be sidetracked. We will focus principally on this task, defeating and overcoming coronavirus, reopening the economy, reigniting the Gauteng economy on a path for reconstruction and recovery, and supporting those amongst our fellow human beings and citizens who have been terribly affected by COVID-19. That includes victims of gender-based violence, the unemployed and the hungry and the poor. We will continue to focus on that. That's what the Gauteng Provincial Government is going to do. In doing so, we will work with municipalities in Gauteng to focus principally on this. I want to repeat that our number one priority is defeating COVID-19, bringing this pandemic under control, ensuring that more lives are saved, ensuring that we reopen various sectors of the economy, various sectors of society, and ensuring that we support those who need the kind of support and care that government should provide. On that note, I would therefore like to call MEC Panyaza Lesufi to give us a briefing on the reopening of schools. And then from him, we are going to go into a set of briefings from our team in the Department of Health and the Advisory Committee on COVID-19. MEC Lesufi, over to you.
Thank you so much, Honorable Premier and fellow MECs and members of the Council. We truly appreciate the opportunity, Premier, to brief parents about our readiness in terms of education in our province in Gauteng. I want to put it categorically clear, come Monday, the 15th of February, Gauteng is ready to welcome our children. We are not only ready, I think we have made all possible preparations to ensure that everyone that is a stakeholder within the education space give us the go-ahead. I'm proud to declare, Honorable Premier, that we met with all the principals in our province and they've given us the green light to reopen the schools on Monday. We met with all the unions, including teacher unions, and they've also given us the green light to reopen our schools. We met with learner formations this morning, and the HOD is still in that meeting. We are quite convinced that they will also give us the green light to reopen the schools on Monday. So from all our education stakeholders, including the SGBs, we have received the green light, and we are so proud that all of us can't wait to welcome our little bambinos on Monday so that we can start the academic year. One of the crucial points in dealing with the reopening of schools is the issue of admissions. In Gauteng, you are quite aware that we are conducting an online admission process so that we can be in a position to admit our children within our schooling facilities, especially for grade 1 and grade 8. We received a total number of 222,275 people who applied for their children to come to our schools for grade 1 and grade 8. That's 222,275. Of the 222,000, we have already managed to place 219,871. So in Gauteng, we are only left with 2,404 learners that we need to place in our schools. Of the 2,401 learners that still need to be placed, we are quite convinced that by the end of next week, we would have concluded the placement because we have ordered mobile classrooms to alleviate pressure where it's needed. Of the total number of learners that have applied for grade 1, that is 105,000, we've placed 104,000. For grade 8, of the total number of 116,000 that have applied, we've managed to place 115,000. So we are quite convinced that we have managed to deal with this aspect, and we are assisted by the 2-week-long break that we received when the national minister announced the postponement of reopening of schools. By last year, this time, we had 47,000 learners that could not be placed. This year, we are at 2,400, which simply means that before the end of February, we are quite convinced that we would have placed all learners. The major snag, Premier, which is the major snag that we'll see many people moving up and down saying they've not been placed, is that we received 33,480 applications. Of the 33,480 applications, none of the parents brought their documents. And these are the 33,000 that we could not process their applications purely because we didn't receive any form of documents. And those documents are crucial for us to determine whether we should place you. You can't make an application, for example, for grade 8 when you have not given us proof that your child has passed grade 7. We can't place your child when you don't have a birth certificate. We can't place your child when we don't have the immunization card. We can't place your child when we don't have documents like their ID, work permit, and all other related documents. So we've got 33,000 parents that have not given us these documents, and on the basis of that, their children have not been placed. So what we have done now, we've amassed a team because we've got the contact numbers of all these parents, we've amassed a team to individually call these parents and check how fast can we assist them. So that's the only area that we are dealing with, and hopefully, as we have indicated, by the end of February, we'll have concluded this task, and everyone will be within our classrooms, and we can place all our children. The last part that is a major problem within the placement of learners is that majority of parents prefer certain schools, and all those schools, 418 to be precise, are full to the brim. We can't even add an additional desk. We can't even add an additional chair. We are pleading with parents to go for the alternative schools that we've given them so that we can have our children back on the 15th of February, that is on Monday. So that's the only other problem that we have. But besides that, we are quite excited. Premier, we're also proud that on Monday, we are going to open at the top of the range school in Gauteng. It's called Abraham Hlophe Primary School. It's a beautiful school. We're heading it over to the community of Gauteng, and we're pleading with the community of Gauteng, please take care of that beautiful school. It's an amazing school for a primary school. We've got laboratories, we've got libraries, we've got school nutrition center, it's got sporting facilities. We really believe we are changing the face of township education in our areas. I want to thank MEC Roti Queen, Tasnim, Motara, and her team for the amazing work that they've done in that school. It's an abnormal, beautiful school, if I have to say it myself, and I want to thank the team for the hard work and dedication. We are bringing back our commitment to open a new school every month in our province, in particular, high-pressure areas, so that those areas that need additional schools, they can get schools as quickly as possible. Honorable Premier, we've concluded the delivery of PPEs, that is hand sanitizers, surface disinfectants, liquid soap, 2 face shields per every educator, 2 masks for every learner, especially those in grade 1 to 7 and grade 2. We have finalized the distribution of all this equipment so that our children can be safe, but most importantly, our educators can execute their mandate without fear. We've also concluded the delivery of LTSM, that is the learning, teaching, and support material, textbooks, and stationery. There is no single school in our province that has been declared a Section 20 school that does not have this material. We are monitoring some Section 21 schools that might not have concluded the buying of stationeries, but we are quite pleased that almost 99% of all our schools have concluded this process, and they've already started distributing this material to learners since yesterday. Unfortunately, Premier, we lost almost 34 educators through COVID in our province. We are now in the process of replacing those educators through temporary appointments. We've also welcomed almost new 4,000 teacher assistants, and we want to thank our president for this, who will be providing additional administrative support to all our teachers in all our schools in Gauteng. We've also made it possible. We've also concluded the process that has been part of the presidential youth employment process to ensure that all these young people are available in all our schools to screen all our learners when they arrive on Monday. I want to thank all these young volunteers for their commitment and dedication. Premier, come Monday, we are starting to feed almost 1.5 million learners with a hot meal every day during the week. This is a major achievement for us as part of fighting poverty within our school premises. We started this process even before the school can reopen, but we know majority of these learners will get this hot meal as from Monday as part of fighting poverty in our province. There are 3 new schools that we are going to reopen in our province during the first quarter. There is a school called Sitlawucha Primary School is in Everton, and another school called Tshepiso Primary School in Tshepiso, also in Sidibeng. These 2 new schools, we believe, will alleviate pressure in that area and will also assist us to ensure that our learners are accommodated in those new schools. There were 370 schools that were vandalized by our communities, which is a sore point. It's something that makes us very angry. Of the 370 schools that were vandalized, we are proud that 332 of them have now been fully repaired. We are asking our communities, please take care of these schools. Premier, unfortunately, there are 2 schools where community members, including SGB members, deliberately burned down those schools. We have told them we are not going to repair those schools, they must see to finish. We can't take money from people that need new schools and go and repair a school where parents have deliberately burned down that school. So those 2 schools, they are standing unattended because we are committed to our cause to say if you burn down a school, you will see to finish. We are not going to assist you. We have also delivered 211 mobile classrooms, and we are addressing the shortages in areas where we really believe there are additional classrooms that are needed. Premier, we have identified 108 schools in 14 districts that need additional support. What we have done, we have transferred funds to these schools so that they can, in the interim, assist us to build additional 408 classrooms that are needed. And majority of these schools have concluded this task faster than we normally do as a department. And I want to thank the principals and the SGBs of these schools for this kind of support. We are also ready to ensure that all public transport, and this is not government transport, any transport that is transporting our children, whether private or public, these transport service providers must adhere to all the safety guidelines that we've introduced. I want to thank the Department of Transport for their support. Each and every transport service provider will have a sanitizer, will ensure that there's social distancing and there's no overloading, and the windows of the schools, of the buses or the transport they're utilizing are half opened to ensure ventilation. We have also appointed what we call scholar transport brigades to ensure that there's adherence to these regulations. And these regulations will assist us to ferry almost 600,000 learners within our province. Premier, I want to conclude by thanking all our matriculants. The matriculants of 2020 have made our province proud. We want to thank them for their dedication, their commitment, and their hard work. We have concluded marking. We are now consolidating the marks so that we can hand over this to the National Department, and the National Department can hand over to Umalus. But to our learners, we are proud of you. We thought this will be a lost case, but from the preliminary work that we have assessed so far, we are proud of you, and you should be proud of yourselves when the results are released. We want to urge Umalusi to say, assess these learners fairly. There was COVID between 2019 and part of 2020, and these children have worked abnormally hard. Please ensure they are not penalized unfairly. We remain hopeful by the time Umalusi releases these results, and by the time the minister releases these results in 2 weeks' time, our children and our parents will be proud of the class of matriculants of 2020 for their hard work and dedication. To those that have passed, we wish you well, and those that have not succeeded, hopefully you'll find new opportunities that will make you to succeed in life. Thank you so much.
Thank you, MEC Lesufi. The critical question that we are looking forward to being answered is whether 2020 was a lost academic year or not. When we look at the full story of 2020, and I know that we had to battle against a lot of uncertainty about whether schools must be shut down completely, whether that 2020 should have been something we forget about, but those who insisted that we must do everything in the midst of the pandemic to ensure that the learners and our children don't lose that year are waiting to see if we have succeeded. So I am looking forward to hearing what the grade 12 results are, but as you know, MEC Lisuf, we don't only look at grade 12. In this province, we have made a commitment that we're now looking at the results of all the grades from primary school to see what the impact of this year would have been. And we don't, even with that, we don't want excuses. We really want our children to have the best and to give the best. So at this point, let's get back to the question, where is the pandemic in Gauteng? And where are we going from here? So I will hand over, therefore, to the chairperson of the Premier's Advisory Committee, Dr. Mary Kawonga, together with Professor Bruce Melado. They are able to give us a sense of what the numbers are saying, what the trends are saying, and also suggest what should be our response. And then after that, we will go to the next presentation on the rollout plan. Dr. Kawonga, over to you.
Thank you, Honourable Premier. Good morning to MECs and colleagues. Thanks very much for the opportunity to once again give feedback on the status of the pandemic in the province. Thank you. All right. So, good morning to members of the media and to the public in Gauteng. So the last time we were here with Prof. Melado, which was 2 weeks ago, we gave an update on the status of the pandemic. And we mentioned at the time, based on the numbers we were seeing, that there were indications of a receding pandemic. The force of infection was reducing, and we were cautiously optimistic that we were seeing the end of the second wave, but we were not yet there. And we said that we were going to continue monitoring and would come back and present an update. And so that's what we're doing today, to give you an update and then sort of talk a little bit at the end with some conclusions. So as usual, I will start and go through some of the epidemiological indicators that we've been tracking to track the trajectory of the pandemic. And Prof. Melado will come and present on the status of the hotspots in Gauteng, and the COVID-19 risk indices for resurgence in Gauteng, and then I'll conclude at the end. So in terms of the status of the COVID-19 pandemic, as usual, we cover 4 key indicators. That's cases, test positivity rate, hospitalization rate, and mortality. And when we look at mortality, we look at COVID deaths as well as excess natural deaths. So just as usual, we start with the overall picture of the pandemic in Gauteng. And this is the usual picture of the 2 waves. And you can see as the second wave is receding, the numbers are significantly lower than they were a few weeks ago. But we're not yet down to the levels that we were seeing before the second surge started. That's the graph at the top that's showing you the red circle with the arrow. If you look at the bottom graph, it's showing the trend in terms of the recoveries and cumulative cases in green, recoveries in yellow. The graph in brown at the bottom, you can see it's got 2 bumps. There was the bump in the first wave, the pointer is somewhere. The bump in the first wave there in July, and the one in the second wave that happened during December and January. And as you can see from that graph, obviously our second wave was smaller than the first wave, it was flatter, and it was narrower as well. So we had less, the second wave was certainly less intense than the first wave. I'll come back to that at the end, just to comment on that. So just to look at very closely, a little bit more closely at the second wave itself. So these are the numbers. The blue is the new cases, and the red line is the 7-day rolling average. So in the last 2 weeks, we've seen a reduction in daily cases, but as you can see, they're day-to-day fluctuations. So there are some fluctuations we see on a day-to-day that are attributable to the testing. So testing often reduces a little bit over the weekend, and so what we see ordinarily is that Monday, Tuesday, the numbers go down a little bit. They come up again on Wednesday and Thursday. So that shouldn't worry people to think that we're going back into another surge. That's just the normal variation that we've been observing throughout the pandemic. So that's why it's important to also follow. The red line is showing us a 7-day rolling average, which is definitely reducing. The only observation we made in the past 2 weeks was that the deceleration has slowed down a little bit, but it's still on a downward trajectory. If you look at the weekly numbers, it's the same thing. 4 weeks, consecutive weeks, we've seen a reduction in cases, weekly cases per week. But if you look at the total number of cases in the last week, epidemic week ending on 6th of February, there were just over 5,000 cases, which is still higher than the number of cases we were seeing before we went into the second surge. But the reduction is definitely there. So that's the cases. Let's look at the test positivity. So this is a graph that we often show. It's showing two things on this graph. The first is the bars are the number of tests that are done. The green is the private sector, and the yellow is a public sector. And as you can see, over the second wave, as it was in the first wave, the number of tests increased, peaked, and then started to reduce. And that's usually a reflection that there's less demand for testing as the pandemic starts to recede. The thing we want to just really comment on is the black dotted line, which is the 7-day rolling average of test positivity rate. And at the peak 4 weeks ago, it was at 30%, but we're now seeing that it's at 8.3% on 11th of February. So that's a significant reduction. It's less than 10%, an indication of lower community transmission risk. The third indicator is hospitalization. As you can see, the pattern is exactly the same as with cases, upward, very rapid increase in the hospitalizations. And we're starting to see a reduction. And again, 4 consecutive weeks, we've seen a reduction in hospitalization numbers. The last week, the complete epidemic week, the numbers are still above 1,000 admissions a week, which is quite a lot higher than we were seeing before we went into the second surge. But it's comforting that it's a lot lower than what we saw at the peak of this wave when we were seeing over 3,000, almost 4,000 admissions per week. And the last indicator is mortality, similar pattern. The only thing is mortality lags a bit behind cases. So we've had 3 consecutive weeks of reduction in mortality. The reduction or rate of decrease is not as rapid as with cases. However, there is a slight reduction. What we've seen is in the last epidemic week that ended on the 6th of February, 452 deaths that week, which is still a high number, even though it was lower than what we saw at the peak, which was over 700 deaths in a week. And so we'll continue monitoring the mortality as the pandemic progresses. The last slide is just to show the excess natural deaths in comparison to COVID deaths. So the red line on this graph is the COVID deaths. The blue line is the excess natural deaths. Last time we were here, we indicated that we hadn't seen a reduction in excess natural deaths yet. But as you can see, the blue line is now on a downward path. So we're seeing a reduction in excess natural deaths as well, which is an indication probably that we are definitely seeing the pandemic receding. So that's the end of my section of the presentation. I'll come back at the end to just give a few concluding remarks. I'm going to hand over to Prof. Malado now.
Okay, so thanks for having me, Premier, MECs, HOD, DDG. So I'm going to continue what Dr. Kawonga has indicated in regard to the trends. I'm going to look now closer into the geospatial picture of what's going on in the province. Now, this graph here is very important because it tells you the number of new hotspots that appear on a weekly basis. you see that we have reached a peak and we are on the downward trajectory, which is good news, as Dr. Kawonga indicated. However, you can see by looking at the right end of the graph that the number of new hotspots is not yet low enough and is significantly higher than before the beginning of the second wave. So that certainly is an issue. That is certainly something that we have to keep an eye on, and we have to be extremely cautious, especially in the light of the fact that schools are reopening. So we want to convey the message to everyone involved here is that the measures that we have been implementing so far that have worked so well, as the Premier indicated in the province, should continue. We have this map that we provide also to the public as to the location of all the hotspots in the province. We have about over 200 active hotspots, which activity, of course, is now diminished compared to about 2 weeks ago. And you can see that by the color code. We attach a color code to each cluster, where clusters that are severe, that are growing fast, have a reddish color code, where those that are slowing down have a lighter color code. You can see that the absolute majority of the clusters have now decreased activity. It's hard to see this graph, but basically what we do is we provide the severity of hotspots in the province. If you compare our report of 2 weeks ago compared to today, you can see a strong reduction in the severity of the hotspots. That being said, as I showed earlier, we do have still a significant number of new hotspots coming in, so we have to be extremely cautious. It's nice to compare graphs and the situation of the pandemic, for instance, in Johannesburg. The upper graph is the report that we gave 2 weeks ago compared to the report of today, where you can clearly see by the color code that most of the clusters and hotspots that had this reddish color have basically now a whiter color, meaning that they have less severity. We still have some issues and some activity, as you can see there when we zoom in into Alexandra in Johannesburg. So that's as far as the location and the status of the pandemic across our map. But it's also very important to understand we have to give a metric, a number, what is the probability of resurgence, given the fact that numbers are going down, but they're not low enough. So we have to give an actual statement that is quantitative. So on our website, we provide a risk index, which is basically a measure of the probability of a second resurgence, and that risk index has to be below a certain number, that is 7.5. You can see the index growing in the beginning of the second wave, peaking and then going down. You can see, for instance, Tshwane is doing fairly well, it's now below the medium risk. However, followed by Johannesburg. However, we cannot send a message to everyone involved here that if an area has a low index of risk, that we should relax and not wear our masks, because we are a big ecosystem, we are a big family in the province. We can pass through transport and through movement in the province the virus from an area that has more cases to an area that has less cases. So we have to monitor that very closely. And here, my last graph here, you can see we go to the sub-district level, Kuruleni on the top, Johannesburg in the middle, and Tshwane at the bottom. You can clearly see that different districts and sub-districts are behaving differently. When you look at Johannesburg, you have Johannesburg B and G that are now below the medium risk, and others are approaching that. And it's Tshwane, most of the sub-districts seem to be below, but you still have two that are above, and of course we have to be very, very alert. And with that, I will give the floor back to Dr. Kawonga.
Thanks very much, Bruce, for that presentation. So just to conclude, I think taking all of what we've presented thus far, the data on cases, hospitalizations, test positivity rate, and mortality, and the hotspots that are receding, and the risk indices that are reducing, this really shows to us that the second wave is definitely on a receding path, because all the reductions that we observed 2 weeks ago have been sustained. And we really believe that this is probably because of the positive effects of the adjusted level 3 and adherence to NPIs by the population. So the last time we were here, we actually had reported that we were observing a number of things that are going on in the pandemic. And since then, there have been a number of developments. One of them is the adjusted level 3 was readjusted. But ever since that was readjusted, we actually haven't seen a resurgence in cases. There's been a stability in terms of the cases. The reduction has continued on a downward trajectory. And the other thing that also has happened in the last 2 weeks is various researchers have reported that the SARS-CoV-2 variant 501v2 is dominant also in Gauteng. And so this is interesting because the coastal provinces is where this variant was first reported. And the coastal provinces had a very severe second wave. Gauteng's second wave was a lot lighter than theirs. And so there are a number of reasons that could explain this. But one of the things that could possibly explain it and could be that by the time the level 3, the adjusted level 3 was implemented, it was probably implemented at an opportune time before the variant could take hold. And so I think what we're seeing really is our conclusion is that we're seeing the positive effects of the adjusted level 3 and the public's continued adherence to non-pharmaceutical interventions. And so really the cautionary tale here is that even though we've seen this reduction, please let's continue. Because whatever we've been doing, whether it's masking, sanitizing, avoiding crowds, etc., it seems to be having a positive effect on our pandemic. And so we just want the public to continue doing that. So the numbers that we have seen are showing a reduction, but we're still cautious. And I know I'm often asked, why are you cautious? The numbers are low. As you saw from our presentations, the numbers are not yet lower than they were before we went into the second wave. And that's why we're really cautious about it. So even though what we're presenting is positive news, in that we're in a better position than we were 2 weeks ago, reduced transmission is not the same as, reduced risk is not the same as no risk. So the risk of a third surge and a fourth surge still remains. Susceptibility to infection is still high in the population. Not enough people have been infected. And even if they have been infected, the research is showing that there might be issues around immunity to new variants and so on. So we do have to maintain the guard and adherence to non-pharmaceutical interventions. So a third wave is still a possibility, and an adherence to NPIs must continue, even if we do start the vaccine rollout, or rather when we do start the vaccine rollout, we still have to continue with that. So the amended vaccine strategy, Premier referred to this, I think was a blow initially when it was announced. But as Premier said, it's not the end of the world. The rollout is still going to continue with a different vaccine. And the preparations are there, and it's going to continue going on. So that's important. But even as the rollout continues, NPIs will continue being the mainstay. And that's what we need to continue doing. So schools are opening next week. That's the other thing that's new. The MEC spoke a lot about preparedness and all the things that are being done. And obviously, the schools opening is a good move. It's the right thing to do. Questions are often asked, is it safe enough for schools to open? Well, I think the case numbers are fairly lower than they were before. And there's no reason why schools cannot open. So the difficulty with schools opening is not the fact that schools are opening. It's about whether we're doing the right things in schools, in our communities, when schools open. And so the things that we want to highlight is that when schools do open, one of the concerns people raise is about the fact that children will transmit infection to teachers and teachers to children and so on. That's always a possibility where people come into contact with each other. Viral transmission, a viral spread is going to probably happen. However, there's evidence to show that people under the age of 20 are at lower risk of infection than older people. And if you look at the Gauteng data over both waves, the age group under 20 has had the lowest case numbers. So there are indications that children are probably at lower risk. However, we do need to be cautious, and we're going to highlight 2 areas of cautiousness and being vigilant. So the 2 key areas are obviously vigilance in schools, and the MEC has talked about how the schools are preparing to ensure that they remain vigilant. So what we've been doing in wave 1 and wave 2 must continue. There's no reason why we shouldn't stop. So the screening, ensuring there's consistent wearing of masks in schools, continuously talking to our learners that even when they're having lunch together and just huddled together having lunch, they shouldn't huddle too closely, and they shouldn't take off their masks. And so that kind of continuous education, and also the schools enforcing adherence to MPIs, is essential. And apart from that, there's the vigilance that must continue in communities. Because I think the data in South Africa, and there's more extensive data in some provinces than others, shows that a lot of the infections we see in schools are attributable to what the transmission that's going on in the community. So as much as the learners and the teachers and schools will have to be cautious, there's also cautiousness and vigilance at home in public spaces. It's not just for the teachers and the children, but also the people at home. So it's about maintaining the vigilance at home, on public transport, in public spaces. The 3 C's, last time I was here, I was talking about the 3 C's being our mantra. It's really about continuing with those 3 C's. So over the next 2 weeks, because there are all these things that are happening, the schools are opening, there'll be a lot of movement, we'll continuously monitor the data and just try and see what happens with the indicators. So far, in the analysis that's been done in Gauteng, schools have not been identified as hotspot areas necessarily. And so we're going to monitor anyway to see whether we start picking up hotspots in schools, just to allay any anxieties in the community as well. On that note, Premier, I'd like to say thank you very much.
Thank you. That completes the science, the data, the tracking of where the epidemiology of COVID-19 is, and the trajectory that the second wave took in our province. I just want to emphasize that the second wave in Gauteng didn't exceed in infections, that it didn't exceed much of the first wave. If you look at those 2 graphs, they are very, very close to each other. The first wave, we had a daily infection of, the highest was 6,200 one day, which was the highest. And then the second wave, on a day we were doing a media briefing, we had 6,900. The difference was like that. And then followed by a plateauing, sustained plateauing over that. But the feedback we are getting, there's also elements of clinical feedback, but we still have over 4,200 people admitted in our hospitals in Gauteng. Now, 4,200 people in hospital on a daily basis is a lot. The number was at some point 5,500. It has come down by over 1,000, but as we speak right now, we have over, that's in the public and in the private sector. We have over 4,000 people who are still in our hospitals. This has a bearing on the mortality, on the fatality rates. Just last night, with the numbers announced last night alone, Gauteng had the highest mortality, 82 people. We have lost 82 people over 24 hours. The message we are conveying is that even though the numbers, all the other things are moving in the right direction in terms of reduction, we're still facing the pandemic. We want to convey this message clearly. We're still facing the pandemic. We still have a lot of people. Less, yes, it is the number of new hospital admissions are less, but we still have a lot of people in hospital. And we are still losing people on a daily basis, which means we must be vigilant. We mustn't think that the second wave It's over, and in fact, I saw a video last night about a community in the West End where over the weekend there was another wild party, just over the weekend. That video was sent to me, a wild party. That's what happened just in the run-up to Christmas and New Year. Those wild parties had a huge impact on the infection rate. We saw them in Tshwane. That's why Tshwane was the key driver of the second wave. It was wild partying. I saw a video sent to me yesterday about a wild party in the West End. We want to say to the people of our province, we don't want the third wave. We have lost many lives. The vaccination program is going to start, but it starts with the healthcare workers. To get to everybody will take time. We need cooperation. We need collaboration of communities. So that is my message as I call Mrs. Mupe, the COO of the Department of Health, to share with you our vaccination program, the vaccine rollout program. Whichever vaccine is going to be coming, this infrastructure and the plan will just be adapted. Over to you, ma'am.
But if you want to use your computer.
Thank you, Premier. Can I just ask for permission, Premier, to lower my mask? I know that sometimes my voice just dips and people lose me, especially when I'm wearing a mask. Please, Premier. Thank you very much, Premier, our honorable MECs that are here and heads of department, and members of the media, as well as my colleagues in the Department of Health and those that come from outside the Department of Health. So my duty today is to present the vaccine plan and the status. As the Premier said, yes, as Gauteng, we are very disappointed because we had prepared adequately, and we are still prepared. We're just waiting for the date and the delivery of the vaccines, and we will get the rollout rolling. So what is going to happen is that as Gauteng as a province, we are aiming to vaccinate 67% of our total population. We know our total population is about 15,488,137. And we are, the 67% of that is 10.3 million of people that we're going to vaccinate. These people are going to be vaccinated in 3 phases. The first phase, as the Premier has said, will focus on the health workers, both in the public and in the private sector. So the total population that we're aiming to vaccinate during phase 1 is 215,101. Then in the second phase, then we move on to essential workers, and with essential workers as well as people that are in congregate settings. So people that are in congregate settings, we talk about people that are in rehabilitation centers, people that are in the correction centers, people that are also in the old age homes. Those are all the people we're targeting. So as well as those that are over the age of 60 years and persons that are over the age of 18 that also present with comorbidities. So the total population there, it stands at 286,000. And in phase 3, we are going to be looking at people that are over the age of 18 without comorbidities. This is the general population that we will be vaccinating. This is a big group of people because it translates to close to 3 million, 2.789427 people that we target to do during the phase 3. Now, as the Premier already has said, is that the Minister of Health put on hold the rollout as planned for the 10th of February because of the less efficacy of AstraZeneca vaccine, and Johnson & Johnson was coming on board. It is proposed as an alternative to the AstraZeneca vaccine, and it was approved by SAPRA. We know that it has to go through that, but how it's going to be implemented, it's going to be implemented in a manner that it also generates a lot of questions and answers to the efficacy of the Johnson & Johnson as it is rolled out. So the South African Medical Research Council is responsible for this, and all the facilities that we identify will make sure that they're closer to SMRC so that the research continues. As Dr. Kawonga said, they are scientists, they're public health specialists, they must from time to time keep tabs on how the virus is behaving and also guide us into how we should be implementing our activities. So as the Gauteng province, the two big hospitals that we've identified where we'll start the launch will be at Charlotte Maxeke and also at Steve Biko Academic Hospital. This is where the launch will begin, and I must say that we've been to those hospitals, we've seen to assess their state of readiness. And Premier, I'm very pleased to say that what we saw as the hospitals were demonstrating to us the flow of the patient, they were taking us through the journey of the patient or the healthcare worker as they come into the facility up to a point where they are vaccinated and put into the observation room and out of the center. That flow was very, very effective, and we were quite happy with that. And we were confident to say that we are ready. So we're waiting for the National Department of Health, as the Premier and Dr. Kawonga have said, to communicate the date, but we are ready. As the Gauteng province, we have set up governance structures. They operate at different levels. They operate at strategic, tactical, and operational level. At the strategic level, we've got our political leadership that is guiding and providing oversight in ensuring that things go as they're supposed to. The Premier of the province has also established an EXCO subcommittee that works with the tactical and operational level so that it is able to identify challenges as and when they appear and feeds back to the PCC and the PDMCC, and we deal with these matters. And on the side, we've got our technical advisory structures in the form of clinical governance structures and also the PEC, which we often refer to as the Premier's Advisory Council. Dr. Mary Kawonga is one of those, I hope you know. And then at operational level, we have deployed vaccination coordinating committees that deal with the day-to-day running of the vaccination as it happens in the various districts. So these are the composition of the executive committees of the EXCO subcommittee. It's all the MECs that are listed there. Our Director General as well is part of that as an ex-officio member, and they also invite a labor representative as and when they are required, because they are a very important stakeholder in this. They can't be left behind. And there's also the technical vaccinating coordinating as the streams and the strategic advisors. Those come as per invitation. So I spoke about the Special Executive Council Committee that was set up by the Premier, and it has got its clear terms of reference on what they do. And you see, as you see on the slide, that they finalize an Executive Council memorandum of the rollout. They monitor and report to EXCO. They make an assessment on any additional activities that require to be speeded up. They recommend interventions where necessary, and they invite officials to present reports on any matters that are related to the rollout, and they ensure that the measures are developed to address possible vaccination hesitancy. They also provide final closeout report at the completion of the rollout process. So also as the NEF Center, we have also established working groups, and these working groups are established in terms of the 9 pillars of the rollout plan. We've got the governance structures, identification of the population service delivery platforms, HR, including training and supervision, vaccine cold chain logistics and infrastructure, safety and surveillance, data management, communication, demand creation, and social mobilization, budgeting. These are the working groups that work on daily basis in ensuring that we are completely ready, and as there are challenges on the ground, they pick them up quickly and they refer the matters to the various structures for assessment. So we've got lead persons. If anything goes wrong in any of the working groups, the lead person takes responsibility, but this person is supported by the second in charge. We've put names against this working group so that things don't fall within the cracks. And over and above that, we've got people that come from the Office of the Premier, that come from other government departments to support these working groups, and local government as well is also part of this to ensure that things are in order. We also have a public health specialist that are operating as advisory to the working groups. So these were the timelines that we had set for ourselves as a province. These are the dates and the activities that we're going to do had we launched on the 10th. But it's not all lost, as the speakers before me said. These dates will need to be adapted, as the Premier said. As and when we are given a new date, we're going to go back to the rollout timelines and adjust and adapt them to the date that would be given at that time. So this slide here just shows you it's a disaggregation, it's a map that shows a disaggregation of the public sector target population per districts. It gives you the number of employees, and it also gives you the facilities that are there and disaggregates them into central, tertiary, district, and CHCs or primary healthcare. And also it gives you the number of vaccination sites per district. And in the private sector, the list that we've been given is that in terms of their health workers, they've got 129,496 health workers disaggregated, as you see that on the slide, and they've got 154 vaccination sites. So these numbers are included in the very first slide that I presented. So in terms of the vaccine allocation by the National Department of Health, as I said, in the private sector, they've got 129,496 employees, but we will receive 130,000 vaccines. And for the public sector, it's 81,107, and we're going to receive 85,500. These numbers may change, because this is what we had for the AstraZeneca vaccines. The J&J, we still have to hear from National what the number of doses they will give us, but the number of employees will not change. So we will await that, and then we will adjust our plan accordingly. So in terms of the vaccination sites, primary healthcare facilities, we've got 191 and 33 hospitals, and in total we've got 224 vaccination sites, and they are disaggregated per district, and we've got 808 vaccinators, and the numbers are there, as you see them, per district. So the three coming slides that I'm going to present here are just showing you the state of readiness and explaining in detail when I meant that we are ready. If you look at all the 10 launch hospitals that we were targeted per district, it's all green. It shows that we are ready. And we're not ready by mouth. We have been there to those facilities to see for ourselves if what is being reported is a true picture. The working groups that I spoke about at the beginning of the presentation, those lead people and their second in charge went to these facilities for themselves to go and assess. That was, of course, preceded by a Teams meeting that we had with the CEO of the hospitals and the ambassadors that are assigned the responsibility of ensuring that the vaccination rollout goes ahead without any hiccups. They came back, they were comfortable, and then that what follows by a site visit, and coming back from the site visit, we were quite clear, happy that things are in order. These are the 3 slides that I'm talking about. So in terms of readiness assessment activities, also what was important is the monitoring of the cold chain survey that was conducted. It was conducted for purposes of assessing the suitability of the fridges that are available at our pharmacies, and also the storage capacity for the COVID-19 vaccines, and also the digital continuous fridge temperature monitoring systems. It is important to have this. We know that before we had the WHO-approved fridges, the temperature of the fridges were monitored in the morning and in the afternoon, just before people went home. But for the vaccine, it is important that they are monitored. For every 15 minutes, we must know if the temperature is still normal. As and when it goes down or it goes up, there is an alarm that goes off that informs us that now the temperature is not all right, and we've got to adapt to that, adapt it. And also there are cooler boxes and ice packs for the facilities that don't have big fridges, and also there are backup generators that we've put in place for our pharmacy fridges. Oh, my apologies. This is just an example of what we saw when we went to Barra on the 5th of February to check for ourselves if we are ready. Now, anyone who's looking at this picture would agree with me that this looks very convincing. And it was just not pictures. We had people flowing in to make it real, Let's see how it happens in real life. And patients were coming in, some were patients, some were people in the hospital that were put there to work with them as they go through this journey of vaccination. This is the hall at Baragwanath, Chris Hani Baragwanath Hospital. And you can see the social distancing that is maintained there. You can see how people are going to be comfortably seated to ensure that they have a very good experience of the vaccination rollout. These are the WHO approved cooler boxes that are referred to, and these are the chairs that shows and maintains the social distancing, and the refuse bags for all the refuse that we'll be collecting at the site, and also the information data capturers there. So this is an area where people are going to be observed after 15 minutes of a vaccination. We know that sometimes it does happen that people experience what we call AFI, adverse events following immunization. So we keep people for 15 minutes after they've been vaccinated to make sure that they do not react negatively to the vaccine, and as and when they are fine, then they can leave the vaccination site. Now, according to the work streams, work groups that I spoke about earlier on, Labour is an important stakeholder. It was engaged on the 1st of February, and our communicators, I must say, they're doing a good job for communicating with our health workers and also the public. They are using various media platforms to ensure that they dispel the myths and the conspiracies around vaccination, and also keeping them up to speed with the changes that are happening with these vaccines. In our facilities, as I said, we did simulations, and we also had Microsoft Teams meetings to assess the state of readiness and also giving them up-to-date information. And as I said, all facilities have also established vaccination coordinating committees for the day-to-day running of the rollout. In terms of the cold chain, as I said, these vaccines need to be stored in the fridges that have the temperatures of between 2 and 8 degrees Celsius, and I went at length explaining how that works and why. And also WHO and the South African Pharmacy Council have recommended that every fridge must have a temperature monitoring system that will send information if there's a deviation, as I stated earlier on. In terms of hospital compliance, I said 100%. They are compliant. They have a space to accommodate vaccines for phase 1 and also temperature monitoring. There are cooler boxes for moving the vaccines from one area to another, especially from the district pharmacies into the PHC facilities, and also the transport for cold chain monitoring devices. All that is in place. The district pharmacies also are compliant. They've got space also to accommodate phase 1 vaccines, and also in terms of temperature and cooler boxes, all is in order there. In terms of surveillance, I know most of the people are very worried about the stealing and the theft that will happen with the vaccines. We've trained 400 healthcare workers in the category of vaccinators, curators, and data capturers on the 1st to the 3rd of Feb. We engage stakeholders, and then there's further training that's planned with the vaccinators that happened on the 8th. This is to ensure that they also are aware and alert that we don't lose vaccines as they move from one base to the other. In terms of security, they'll be stored in the pharmacy, which has security and fitted with alarm systems. We've also involved our own internal Gauteng Department of Health Security and also Prof Joints to assist us with ensuring that the vaccines are safe. They don't just disappear. And one batch of vaccine will be issued to the vaccination site per day to minimize the chances of disappearing of vaccines. In terms of communication and demand creation, I've spoken about that. I'm sure most of us have been seeing on TV and also on radio, National Department of Health communicating the developments around AstraZeneca and the whole vaccine rollout. And also as Gauteng, our communicators have also done their part in terms of talking to staff and also the population. And Labour also was also part of that. And as Gauteng, we've taken a decision that the unions and management, including CEO of hospitals, will be part of the first people that will be vaccinated in order to encourage the rest of staff members to be vaccinated. There are question and answer messages in most facilities that are sent out on a daily basis to keep staff up to date, and there's also educational talks that are conducted to staff members on a daily basis in the wards within the hospital. And like I said, there is a vaccine ambassador in each of the facility, and this is the person that ensures the smooth day-to-day running of the vaccine. So in conclusion, Premier, as you said, we are ready as Gauteng to roll out the vaccination plan, and we will be able to launch the program once we are told of the start date and also when the vaccines are delivered. This is not the first time we vaccinate as the Gauteng Department of Health. Vaccinations are our things. We do it yearly. Right now in March, we will be vaccinating for the human papillomavirus. We've been doing measles campaigns. We've done it. We know how to do it. We've been doing it. We have experience. And we've learned lessons from the vaccinations that we've been doing throughout the year. And those lessons came in handy in preparing for the COVID-19 vaccination program. The preparations are continuing, Premier. We are fine-tuning here and there and making sure that things are in order. And our communications caterers are hard at work in communicating the developments as they unfold. And our plans, as the Premier said, are informed by science. And when the scientists say, hold on, we do, and they say, go, and we program accordingly. But, Premier, we are ready. Thanks.
I want to echo what you are saying, Mrs. Mupe, that I am also ready when my chance comes to vaccinate. When my chance comes. I'm not a healthcare worker, but I am ready. I can't wait. And I got these messages from a lot of people who were phoning to say, we are ready to vaccinate. So when the vaccine comes, because we were very concerned. There was a period where the conspiracy theories against vaccines were a matter of great concern to us about how people are going to respond. The healthcare workers are saying they are ready. A lot of people in our communities are saying they are ready. So my concluding remarks today, before we take questions, my concluding remarks is, again, the principal focus of the Gauteng Provincial Government in 2021 is firstly to mobilize all the efforts to defeat and overcome COVID-19. Secondly, to mobilize all the efforts to reignite the Gauteng's economic reconstruction and recovery. And thirdly, to provide all the necessary support to those who have been affected by COVID-19, including victims of another pandemic, gender-based violence, including those who are significant number of people lost their jobs, who require food relief and various combination of support, and to support the reopening of other sectors like schools, including work with the religious sector, even in that sector as they reopen, to work with them to make sure that we are not going to drop the ball. So that's the principal focus of the Gauteng Provincial Government this year. There are a number of things we want to reiterate. Let us continue with the health protocols. Let's ensure that, particularly in our communities, people don't think COVID-19 is gone and then they start going back to partying and doing all the other things that cost us greatly as a people. We also want to say that in addition to those measures, yes, we are ready for the vaccination program. And all the vaccines, whether it's Johnson & Johnson, as long as they've passed through the test, we want to roll out these vaccines to the different sections, 10.3 million people in Gauteng. That is what we want to achieve this year in 2021. And if we can achieve that goal, there are many dependencies, but we want to achieve that goal so that we can move forward. COVID-19 is going to be with us for a while. We must manage it. And the vaccines are the most effective way, the game-changing way. And that is why we're waiting for the vaccines. Our plan, as was presented here by Mrs. Mupe, will be adapted. But we've got healthcare workers trained, we've got facilities ready. Depending on how many doses we will get of the first vaccine, Johnson & Johnson, depending on how many doses we will get. But we are ready to do all the 215,000 healthcare workers. But we will adapt that plan based on that. It is absolutely important that we focus on the economy. And on this note, we are very pleased that our province has received a huge mega investment, $1 billion into the Tshwane Automotive Special Economic Zone this month in February by Ford Motor Company. And that has spurred us into more action. It did not just happen by accident. This mega investment didn't happen by accident. We invested lots of energy working with the municipality, working with national government. We are doing so not just in Tshwane, we are doing so in the Vaal. We are working on the Vaal River City Special Economic Zone. We want to attract investors, significant investors in there. We are doing so in the West Rand, the Special Agro-Processing Zone, that is an SEZ focusing on agriculture and agro-processing. All those plans that we have been working hard on are taking shape and they are yielding results. So as we focus on COVID-19, we are focusing on the economy. We are rolling out our infrastructure projects to boost. This year we will pass the Township Economic Development Bill, which will become a new law that governs economic activity and facilitates the entrepreneurship in our township. That act will be passed by our legislature this year. We are working with national government and the DBSA to help us where we need to invest in bulk infrastructure. Because investors want government to invest in the roads, in appropriate sanitation in that area, in water and electricity. We're also working on the skills for each of our special economic zones. If it's the automotive special economic zone, we are also making sure that we've got schools of specialization to support skills in each of those areas. If it's an agro-processing special economic zone, we are also working through our Department of Education to train young people in the area of urban agriculture and agro-processing. We are doing that in the different parts of our province. We are doing that in the east, our industrial hub in Ekurhuleni. We are also doing that with all the reindustrialization project that we are rolling out there. So the story of economic recovery and reconstruction in Gauteng is not just something we are talking about in general. It is happening. And these investments are creating jobs. We lost 661,000 jobs last year during COVID. And these investments are helping us to trigger investment and getting back these key sectors. At the same time, we are working with various organizations to support and tackle this pandemic of gender-based violence and femicide. And we have supported today up to 7,500 victims of gender-based violence through sustained programs. We have 600 brigades. These are people who are trained to go out into communities to provide support, to be able to get into households and provide support and counseling and advice on particularly the women who are victimized, on how they can come into our existing programs. This is a very, very important area of support for us. So we are calling on the people of our province. COVID-19, especially this very dangerous variant, is still around. We need to understand that we are not over the hill yet. The situation looks very encouraging. It is our belief that we will only really be safe once we have vaccinated. So in the end, it is the vaccine that will provide full answer. As long as we are still walking that road, all of us have a responsibility to assist, to save more lives, to ensure that we don't infect the next person. That's the key message in Gauteng province going forward. We have overcome the second wave, but the third wave is still possible. And we call for caution, and we call for communities to be their own mobilizers, to guard next door that there's nothing that happens that puts the community at risk. So Thabo, back to you. We are ready for question and answer sessions. The MEC for infrastructure is here today. She's not presenting, but I can say that we have increased our infrastructure capacity as we have done. As we have always said that in February we will have a major facelift we have. And some of our facilities are now having lower admission numbers, which also tell us, including Nasrec, we now have lower admission numbers. It tells us that we also need to review some of the provision we have made, but we have sufficient provision for infrastructure.
All right, thank you, Premier. We'll take questions now. I don't see any members of the media here who want to ask. Is there? Otherwise, I'll just read a few that we got. Do we have any questions from here? Show of hand? No hand? Okay. Fine. I think I have a couple of questions that were sent via WhatsApp. I'll just quickly go there. Okay, the one question is from Jared Westerdale from Rodeport Record. And the question, I would like to submit a question for the Gauteng Provincial Briefing. Will the Gauteng Department of Education allow for the resumption of school sport in term 1 and beyond? Then I'll appreciate your consideration. That's fine, from Rodeport Record. And then another question here is from Riante from E-News. And the question, why haven't many junior doctors and sessional workers like physiotherapists and dietitians been paid by the province? Many haven't been paid since November last year. These are frontline workers. The income cannot be delayed at a time like this. Why are there delays, and what is being done about it? These are the only two questions that I have. MEC Lessufi will answer for education, and MEC Mukherjee will answer the ones that are directed to health. I don't know who wants to.
Thank you very much, Honorable Premier. Thank you very much, E-News, for the question. Members of the media, MECs, we have a total number of 633 post-community services doctors. It means these doctors have completed their internship and now they have to be registered as doctors. So out of that, 429 were paid and 184 to be paid in February, and only 20 are still awaiting to be registered with the Health Professionals Council of South Africa, meaning that 97% of the doctors' challenges of payment have been resolved, and only 3% are still to be in progress to be paid. And I want to also say we are really apologizing for the delay. We do understand that these doctors do have also their needs, but when it happens every year, because they are on a system as interns, and when they have to be registered, they also now have to be put into a system because you have to pay for also your medical aid, your pensions and so forth. And we also, when we were here, we also indicated that there were challenges in terms of registration of these doctors, and we have then requested that for condonation, and we were granted the condonation, but unfortunately it was ending 31st of January, and we've really tried to make sure that we work as fast as possible, and we will be able to resolve the 20 that is still outstanding. But as for the rest, there are no challenges. Thank you very much, Premier.
Thank you. In terms of school sports, anything that is amateur sport in the country is prohibited. So under level 3, no amateur sport is allowed, which simply means that we're not going to allow school sport either in term 1 or term 2 unless we've got a new announcement from the family meeting whether sports is allowed or not. So the Department of Sports, Recreation, Arts and Culture, they serve as our advisory institution. So for now, they've advised us that we should hold on in terms of sports and other cultural activities. So it does not mean school will be boring. It just means that we are managing the situation that we find ourselves in carefully. So the simple answer is no sports, no culture, no art, no other activity until the next family meeting advises otherwise. Yeah. Thanks.
See, I must say it's very difficult for children. It's very difficult for children. They are going to end up doing sports illegally because it's in their nature. So those are some of the things we will review now that the schools are reopening, and also taking into account the trajectory of the pandemic. We will be reviewing, we will be going back to the National Coronavirus Command Council on some of these issues, getting feedback from our schools on what we need to do. But for the purpose of today's briefing, thank you very much for being here. We see you when we vaccinate. And I think you should be saying you are all ready to vaccinate. even the media people, you are essential. You are not frontline healthcare workers. You are essential. You must join us to say we are ready to vaccinate. Thank you very much.